2002 mwezi wa 7 ndio nikajifungua vibaya. Yaani mtoto alikufa tumboni tu mwenyewe bila sababu yoyote, sikujua ni nini.
Farida Garama, a mother of 2 boys, would probably be a mother of 4 children today.
Nikapata mimba nyingine tena. Ndio nikazaa 2003. Hiyo ya 2002-2003 ilikuwa pia hivyo na shida. Badala ya kujifungua vizuri, mtoto akafa tumboni.
For Farida, carrying pregnancy to term has been marred by complications that have led to numerous miscarriages. She has lost 3 pregnancies, a matter so close to her heart that she ensures the memory of her children is not lost. She leads us to one of the graveyards.
Kichwa kikawa mahali sehemu hii hapa, huku ndio ikawa ni miguu. Sasa kwa kukumbuka ndio nikaona nipande huu mti huu.
Farida is just but one among thousands of women who suffer miscarriages as a result of complications during pregnancy. Farida's complications arise from low blood level in pregnancy, anemia, which can be controlled by taking iron supplements during pregnancy. The Kenya Demographic Health Survey says that out of 3 expectant women, only 2 take iron supplements when expectant. Farida's complications would also seem to arise from a lack of close medical observation. A gynecologist and the head of the obstetric department at the Malindi District Hospital, Dr. Kapanga, is not new to such cases.
Anemia on its own is a killer to our mothers, to the babies. Many of our mothers, again, when they are carrying the pregnancy, we end up with poor development of the baby because of anemia. You either end up with small babies or you end up with premature deliveries just because of anemia.
Anemia is one of the causes of deaths in pregnant women due to excessive bleeding during delivery, besides malaria and HIV and AIDS. This contributes to the high number of maternal deaths in the region. Malindi District Hospital records 600 deaths, way above the national figure, which the World Health Organization puts at 360 for every 100,000 women who deliver.
The abdomen is soft and not distended.
With Kenya's population growing at least 1 million people every year, this means that this year alone, 3,600 women will die from pregnancy and childbirth-related complications. This number compares to a road accident of 60-seater buses full of women that results into the death of all the passengers. The Millennium Development Goal number 5 seeks to reduce maternal deaths to 100 deaths per 100,000 live births by 2015. But with only 2 years to the attainment of the Millennium Development Goals, Kenya's maternal deaths puts into doubt whether the country will achieve this goal. Dr. Sharif Shanas, Director of Health in the Ministry of Public Health and Sanitation in Kenya, is however optimistic.
We have made tremendous progress in terms of reducing under 5 mortality. We have reduced it and we are now in the acceleration mode. We may not get to the MDG'S, but we'll be successful there. But for reducing under 5 mortality, I think we'll be there on target by 2015.
Sincerely, on the ground, the way I see it is not practical, because there are quite a number of things which are not working out the way we expect. I audit maternal deaths. I audit some few neonatal deaths which appear in the hands of a midwife, and I see they are static. It's like we don't improve. 1 month we have done better, the other month, but generally we are at the same level. So we are at the same level. Why? It is because some of the basic interventions have not entered.
He says most health facilities lack basic means of dealing with pregnancy-related complications.
This is a tool which is very, very,
The hospital has hence come up with ways to reduce these deaths despite obstacles. This maternity shelter is one of the interventions that the Malindi District Hospital is using to reduce the number of women and children dying during delivery. The maternity shelter can accommodate up to 12 women at risk of developing complications during pregnancy. The women stay at the shelter at no cost, where they receive close medical observation.
The outcome is good. So far, we have admitted more than around 2,000, and all of them, almost all of them, they have gone back home and with the live babies. Mothers who would have died in the community, they have been saved, and their babies. Because the ones who came to maternity shelter, especially the ones who needed cesarean section, if they didn't come to maternity shelter, they would have been referred late. And maybe we would have lost the mother, we would have lost the baby.
It has assisted us in a way that at least we can have these mothers nearer the delivering point, which is our labor ward or our maternity ward, so that if a complication develops, we are there to assist.
Farida is a beneficiary of the maternity shelter. Her fourth pregnancy would have ended in another miscarriage had she not sought early medical attention.
Nilienda hapa dispensary, ndio nasi in charge akanirifa huko. Ndio nikaenda, nilipofika maternity kule kwa kawaida sasa. Ndio wakanishauri nisirudi nyumbani, niende kule shelter. Ndio nikaenda. Uzuri wa pale, damu yangu huwa nikiwa na mimba inapungua. Sasa mara kwa mara walikuwa wananipima damu, wananipima pressure, wanapima mtoto vile ambavyo mtoto anapumua. Kila siku walikuwa wananipima mara 3. Huyo mtoto sahihi yuko standard 2. Huyo ambaye nilimpata kupitia kwa hapo shelter.
Long distance to health facilities is another challenge expectant women have to deal with in this region. However, the shelter, which is situated within the Malindi District Hospital, makes delivery quick and safe for the women who are transferred into the hospital during labor.
Some of them come as far as 250 kilometers. Mainly the maternity shelter was a shelter to accommodate mothers, especially those who are coming from very far, who wouldn't access hospital in good time.
Gladys Nyavula has been at the shelter for a few days now, with the nearest health facility being almost 20 kilometers away from her home. This against the World Health Organization recommendation of 5 kilometers. She was not taking chances, having lost her first pregnancy.
Kasikia dalili kama nitaingia kwa mwezi. Nilipoenda chooni, kaona damu, zikanishtusha. Kabidi niende hospitali mbio. Imagine nimeenda hapo saa 1 kasoro ile asubuhi. Mpaka wananiandikia dawa saa 10. Sini muda mwingi sana. Nilipotoka pale, kabla sijafika kwa chemist, ikatoka. Ikawa hiyo nishapoteza tayari. Nilipoona daktari akani refer kule kwa sababu alinipima. Akasema ni maumivu ya uchungu kweli ya kuzaa. Lakini still bado kuna siku kama za kuhesabu hivi ndio jifungue. Kwa hivyo si vizuri nikwambie urudi nyumbani alafu uje tena kwa sababu ya ile hali ya tumbo yako. Kwa hivyo ndio akanirefer ile shelter.
She also suffers from fibroids which put her at risk of developing complications, and so with the doctor's close observation at the shelter, she was able to have a safe delivery.
Kama singeenda shelter, ningeharibikiwa kwa sababu ningekuwa mbali na msaada wa madaktari. Vile nishapata mtoto, nasikia raha sana. Kabisa, najua sawazisha kila kitu. Wamama wote wajawazito wakikaa pale shelter watahudumiwa vizuri, hawatapata matatizo yoyote, kwa sababu pale nurses huwa wako wanawaangalia vizuri. Kama ni kula watakula vizuri, kama kulala watalala mahali pazuri, na hata maintenance pia huwa nzuri pia.
Farida is not only a mother. She wears another hat, that of an assistant chief, a capacity that gives her the opportunity to sensitize the women of Kakuyuni on issues of maternal health.
Upande wa CHWs,
Farida has witnessed many women die in her village during pregnancy. As the assistant chief of Kakuyuni, her day starts with meeting village elders.
Kuna kitu gani kimebadilika mpaka sasa hivi?
Her responsibility to ensure that those working with the community are educated on issues of maternal health.
Mkutano wa hivi karibuni, ajenda mojawapo ilikuwa ni kuwaelimisha wakunga kuhusu maternity shelter ambayo iko Malindi. Ukimwelimisha mama mjamzito peke yake, mkunga kama hajaelimika, hivyo hivyo atatumia akili yake kuongea na huyu mama mpaka asiende kwa hospitali.
Despite suffering one miscarriage after another and complications that almost cost her life, Farida is still hopeful of having a third child.
Nikipata mimba tena, sitafikiria mambo ya watoto wangu sijui wana nini ama sublocation ina nini, itabidi niende tayari huko, ili angalau hiyo mimba ya 6 nipate mtoto wa 3. Ndio ombi langu na ndio maoni yangu.
Farida is lucky to have survived thanks to the shelter of dreams. But this is not the case for thousands of women across the country who are at risk of dying due to pregnancy-related complications.